Hi there, my name's Matt Jones. Today we're going to do an examination of your cranial nerves, which are all the nerves in your head and face. Any pain at all at the moment?
No.
Great. Okay, so the first cranial nerve is controls your sense of smell. We wouldn't routinely examine for this, but it would be normal to ask a patient if they've noticed any changes in that. So that's how we're going to begin. So, Joe, have you noticed any changes in your sense of smell?
No.
That's great. The next thing we'll do is move on to assess the visual system. So we're going to test the optic nerves first of all. There's quite a lot to test here. We're going to need to test the patient's visual acuity. We're going to need to test their visual fields, and we're also going to need to test their pupillary responses. So for visual acuity testing, we would just use a Snellen chart. A full-size Snellen chart would be held at 6 meters, but this has been scaled down so we can just hold it at 2 meters away. So for this next part of the test, I'm going to ask you to read the letters on this chart. Would you normally wear glasses?
No.
No, okay. So I'd like you to cover up your left eye with your left hand. That's great. Now I'm going to hold this at the end of the bed. What I'd like you to do is to start at the top and just read downwards.
HPN DZU FRVE ZHNUD VPDEFR PREU HDNZ UVDHENFP.
That's fine, you can stop there. So that visual acuity is 6/5, which is nice and normal. So if we can do the other eye now.
Okay.
Start at the top and read down.
HPN DZU FRVE ZHNUD VPDEF RP EUHDNZ UVDHENFP.
That's fine, you can stop there. That's 6/5 as well. The next test is for visual field assessment. So for this test, we're going to need to make sure the patient can see everything in his peripheral fields. And the first stage of this is to make sure there's no obvious field defect or any visual neglect. So what I'd like you to do is look straight at my nose. I'm going to hold my hands out to the side. When you see one of my fingers move, I just want you to point at the one that you see move. That's good. Great. So by testing first one field and then the other field, we make sure there's no obvious hemianopia, and then by moving both fingers simultaneously, we make sure one side doesn't get neglected. A more detailed way of testing the visual fields is to do one eye at a time and to use a red hat pin for maximum sensitivity, although you can also do this test using just your finger, although that's much easier, so you could potentially miss subtle visual field defects. So we'll use a red hat pin for the next test. So if you cover up one of your eyes, that's great. I'm going to cover up the same. I'd like you to keep your eye exactly on my eye, okay? We'll start in the middle. You see the pin here?
Yes.
And see the pin here?
Yep.
See the pin here?
Yep.
See the pin here?
Yeah.
So this is just a quick test of the central visual field, make sure there's no obvious scotoma, and now we'll go and do the peripheral fields. So I'm going to go right out to the edge. I'm going to bring the pin in. Tell me when you see it.
Now.
That's great. Down here, tell me when you can see the pin.
Now.
Good. Keep your hand where it is. Tell me when you see the pin.
Now.
Good.
Now.
Great. Swap hands, swap eyes. Okay, so same procedure. Keep your eye on my eye. Going to start in the middle. See the pin here?
Yep.
And here?
Yep.
And here?
Yep.
And here? So no central problem. Out onto the edge. Tell me when you see it.
Now.
That's great. Tell me when you see it.
Now.
Keep your eye on my eye. Tell me when you see it.
Now.
Good. Tell me when you see it.
Now.
That's great. Fantastic. The next part of the visual system assessment is to check the pupils. So we can use a pen torch for this. We're going to check that the pupil constricts when we shine the light in it, and that there's an indirect response on the other side. And then we're going to swing the torch from one side to the other, looking for any relative afferent pupillary defects. So look straight ahead for me. So I'm going to shine the light, looking for a direct response, and looking at the other eye for the consensual response. Looking for the direct response, and looking at the other eye for the consensual response. And I'm just going to swing the light from one eye to the other, making sure that the pupils stay constricted at all times and that there's no evidence of a relative afferent pupillary defect. That's great. The last part of assessing this cranial nerve is to actually look at it. So we'll do fundoscopy now to make sure that the optic disc looks healthy. For this test, I'm going to shine a light in your eye. I'm going to get a bit closer for this one. I want you to look straight ahead and try and keep your eyes still as possible.
Okay.
So that's good. So I can see a nice healthy looking optic disc. And if you just turn your head around this way a little bit, you can do the same thing with the other eye. That's good as well. Another healthy looking optic disc on that side. And those are all the things you need to test for cranial nerve number 2. Cranial nerves number 3, 4 and 6 control eye movements, and we'll test them all together. So for this test, I'm going to ask you to look at my finger, and I want you to follow it with your eyes, but keep your head still. Okay, let me know if you get any double vision as we do it. So looking at the finger and just following it. That's good. That's great. So those are nice normal pursuit movements, but we'd also want to test his saccadic eye movements. So for this test, what we're going to do is I'm going to hold my palm on one side and my fist on the other. I want you to look straight ahead, but then shift your eyes to either my palm or my fist when I say so. Okay, so straight ahead to begin with, and then move your eyes to my palm, fist, palm, fist. That's good. Same up and down. So down to my palm and up to my fist, palm, fist, palm. That's perfect. Last test of the eye movements. I'm just going to ask you to stare off into the distance, pick a point on the wall, and then look at my finger here. And we can see the pupils constricting and the eyes converging. And that's the accommodation response. So that's the visual tests over with. I'm going to test the sensation on your face now. I'm going to use a little bit of cotton wool for this, just so you know what it feels like. It's just a light dab. Okay. So I'm going to test one side and the other, and I want you to tell me if you can feel it on both sides and whether it's the same.
Okay.
Okay. Can you feel it here?
Yes.
And here?
Yes.
Same on both sides?
The same.
Here and here. Same on both sides?
Yep.
Here and here. Same on both sides?
Yeah.
That's great. Okay. Other sensations could be checked, including the corneal reflex. I don't think you'd routinely do that, but if a patient had complained of facial sensory loss, or you found it during the examination, then a piece of sterile cotton wool could be used to test the corneal reflex. I'm going to test the motor part of the 5th cranial nerve now. We've just tested the sensory part. So for this, I'm going to ask you to clench your teeth when I say so. So clench your teeth, and that's fine. Relax. And then clench your teeth again. That's fine. And I want you to open your mouth. Don't let me close your mouth. That's good. Final part of testing the 5th cranial nerve is to do the jaw jerk. So for this test, I need you to just let your mouth hang open slightly. That's great. I'm going to pop my finger across your chin and just tap downwards. That's good. So normally with a jaw jerk you don't feel a response, but an abnormal jaw jerk is where the mouth closes as soon as you lightly touch your finger. Okay, good. Next thing is to test your facial sensations. So to test the 7th cranial nerve, we're going to test all the muscles of facial expression. Now, to begin with, I'd like you to raise your eyebrows up as high as they go. And I'd like you to close your eyes really tightly, tight, 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 and open them up. I'd like you to show me all your teeth. That's good. And then purse your lips tightly shut. Perfect. And relax. So by doing these facial movements, we can look for any asymmetry, but we also want to test the strength of the facial muscles. So we can actually do this by trying to open the eyes against resistance, or try and open the mouth once it's closed. So if you'd like to just close your eyes as tightly as you can, I'm going to try and open them, but don't let me. That's great. Open your eyes. And I want you to purse your lips tightly shut, and I'm going to try and open them. Don't let me. That's good. And relax. And that completes testing the 7th nerve. Next is the 8th. And for hearing testing, we just do a very quick screen using our fingers. So I'd like you just to relax. I'm going to make a rustling noise in front of one ear. Just let me know if you can hear it.
Okay.
I'm going to block the other ear.
Yeah.
And the other side.
Yes.
That's great. Okay, now we're going to move on to test nerves 9 and 10. We can look at this directly by viewing the palate and seeing how it moves. So I want you to open your mouth nice and wide and say ah.
Ah.
That's good. And we can see nice symmetrical palatal movements. Can you give me a cough? Perfect. Okay. I'm going to, at the same time as testing palatal movements, assess the tongue. And I'm going to then move straight on and ask him to push his tongue out, move it side to side to test the 12th cranial nerve. So mouth open again. I'm looking specifically for any wasting of the tongue when it's at rest in the floor of the mouth or any fasciculations. And now stick your tongue out, move it side to side, quick as it goes. Now I'm going to test the strength of the tongue. So if you put your tongue in your cheek like this and don't let me push, that's good. And the other side, don't let me push. That's great. And relax again. We're going to finish off by testing the 11th cranial nerve. So for this I need to get you to shrug your shoulders up, keep them shrugged up. That's great, relax. Turn your head to one side and push into my hand. We're testing the strength of the sternocleidomastoid muscle. You can see the sternocleidomastoid muscle in activation. And then on the other side, push into my hand. You can see the muscle in activation there as well. And then relax. And that completes the examination of the cranial nerves.